Hi, welcome to Body Beautiful. I'm Janelle Marie. Today we're talking with board-certified plastic surgeon Dr. Joseph Mealy in Walnut Creek. Now, Dr. Mealy has been giving out great plastic surgery information for many, many years, and I'm so glad once again to welcome you to the show Body Beautiful. Dr. Mealy, hello.
Hello, it's so nice to be here.
I know, and it's wonderful because we are going to take this segment and talk about breast augmentation revision. And I know that breast augmentation is still really, really popular, but
Sure.
a lot of people out there don't know about breast augmentation revision. First off, as a doctor, do you like doing the revisions?
I do. It's more challenging.
Yeah.
But at the same time, it's more rewarding.
Oh, really? Okay.
Yeah, because we get to do a little bit of reconstruction in the process.
Absolutely. And so why does someone come in for a breast aug revision?
Good question. And there are several reasons. Some have to do with the implants. Sometimes implants wear out and they need to be replaced.
Right.
Sometimes it's just the way we feel about our body. I've had women come in who've had breast implants for a while and they're feeling, oh, they should be a little bit bigger, a little bit smaller. So sometimes it's a matter of just changing the size, even though there's nothing wrong with the augmentation.
Right.
And sometimes the scar that holds the implant in place gets tight or pushes the implant, moves it, so the breast feels firm or it's asymmetrical.
Wow.
And that's something we can correct.
Well, that's good to know that you can actually correct that. Let's go to picture number one. You know, a lot of people
Sure.
like these before and after pictures, and I'm going to give out the websites at the end of the segment so everybody can see before and after pictures all they want. But let's go to the first picture. What's going on here?
So this is someone who's had breast augmentation a while back. They've got a little bit of capsular contracture where the implants
Yeah.
are being pushed up, especially
yeah.
the one on her right side. And at the same time, she has what's called a waterfall deformity, where the breast has kind of fallen off the implant. And this is common when people have gained and lost weight with or without implants. But with implants, often the implant will stay in place, but the breast will fall off of it. So
That
if
is
someone has
crazy.
children after having implants, sometimes we'll see this situation.
That's crazy that it's actually coming off the implant. I mean, that's, and
Well,
with,
especially when we're using a lot of saline implants behind the muscle, the implant is supported by the muscle, but the
Wow.
breast does what the breast is going to do. It gets bigger, and then after pregnancy, it gets smaller and sags.
and sometimes can the implant be put behind the muscle when it should be put on top of the muscle, or do you do it the same way every time?
It depends on the patient.
Oh,
I'd
okay.
say the majority of implants are placed behind the muscle to help with, softening that upper pole, not making it quite as round, fake looking. But if someone wants a really round looking breast, then we go in front of the muscle.
Let's go to picture number two. What's going on here?
Oh, can we talk about the first one?
Oh, I'm sorry, yes.
Because with the first one, what I've done is not just revised her implant, so we've softened up the scar, removed the capsule, but I've also done a lift. And the lift is
Oh, okay.
important to help with that extra skin when the breast is falling off.
Absolutely.
So sometimes we can just monkey with the implant. This time, we had to tighten up the skin too.
And so the scars for the lift are a little more,
Yes.
noticeable, but they will fade.
But they fade.
Yeah.
And it's the only way really to tighten the skin. And the second picture is the same person, but it's from the side.
Oh,
so you
okay.
can really get an
Oh,
idea of what
okay.
that waterfall looks like. Because you can see
Yes.
the implant up high. It's a little too high because of the capsular contracture. And then the breast tissue is low because it's fallen.
So that's the same person as photo one.
Same person. And then what the lift does is
Wow.
it gives us back that unified shape.
I mean, that after picture is amazing. It's such a natural look and so much better than the waterfall picture.
Yeah, and that's what the scar gets us. If I could do it without a scar, I would do
Yeah.
it. But
Well.
I just don't have a way.
And the scars fade. And let's go to picture number three as we talk about recovery time for this surgery.
So this is a patient who has bottoming out. So you can see she has a scar there on the before picture because she's had a lift, she's had an implant.
Right.
Her implants are a little too big for her. So
Yeah.
what's happened is the implant has dropped down.
Oh, yeah.
She was a little concerned about the size, so we reduced the size of the implant, which actually helps with the bottoming out because we have less weight to support.
Absolutely.
And then what I've done is I've closed the lower part of that capsule off and reinforced it. And sometimes we'll even use an absorbable mesh or a mesh in there to give it more reinforcement to keep the implant supported.
And so if somebody has a surgery like that, how long till they can get back to work, back to normal life?
With the breast augmentation surgery, the initial surgery usually is the most sore, especially if we're going behind the muscle. And normally within a week, people are doing okay. Usually 3-4 days before driving, a week before feeling like doing everything they want to do. With revision work, if we're not working a lot on that muscle, recovery is usually about half the time. So 3-4 days, people are back to doing what they want to do.
All right, let's talk about the next picture.
Sure. So this is someone who had
Wow.
capsular contracture. So again, the implants have been pulled up.
Really see that going up, yes.
And the problem is it's asymmetrical, and in clothing, you're going to see one breast more than the other. So often what my patients in this situation are doing is they're really jacking up the other breast to make them look even, but then they've got a lot of cleavage, and maybe
Wow.
more than they want to show. So in this case, we've lowered the implants, and I've done a lift again in order to bring that the softer tissue back up onto the implant.
And so much more natural looking. I mean, you know, a lot of times you can see those kind of fake looking
Sure.
breast dogs. And so
And
this
it
is,
depends a lot on my patients. Some really
Yeah.
want a natural, sort of smoother, tapered look, and others want to have that extra fullness. But even if you have a smooth, tapered look, if you wear a bra and it
Yeah,
pushes things up, you
exactly.
can get that round look.
you can get that
You just don't
cleavage
have
that
to
you
have it all
want.
the time.
And our final picture, doctor?
Sure, and this is another picture from the side. I wish I could show it without the square.
Yeah.
Because her nipple and
Oh.
areola are really hanging off
Yeah.
the very lowest part of the breast.
Wow.
And there's just no way to fix that without doing a lift. At the same time, we can adjust the implant. In her case, the implants were hard and again asymmetrical, so we can soften things up, put in a new implant, and then do the lift to get the shape right.
And you do a lot of these, you know, a lot of operations together, right? If somebody's
Sure.
coming in for a mommy type makeover, they can do a lot more than just this breast aug surgery.
and often that's the case because one of the things that causes these changes in the breast is pregnancy.
Exactly.
So we can do a tummy tuck and take care of the breast at the same time.
All right, that sounds good. If you want to see more of these before and after pictures on any of the surgeries, all you have to do is go to the websites, drmealy.com or sanfranciscobreast.com. And if you want more information, give the doctor's office a call at 925-943-6353. Thank you for joining us here on Body Beautiful. Dr. Joseph Mealy, we adore you. Thank you so
Thank
much
you,
for
Janelle.
joining us on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.